We're here today with Dr. Eric Hussey. He is in private practice in Spokane, Washington, and he is going to talk to us a little bit about the patient that he's brought to us in the article that you're reading. So good. I guess it's good afternoon, or kind of slash good morning where you are.
Yes, it's morning where we are, and so I get to tell you a little bit about Seth. And Seth was a very interesting case in the sense of the history of his injury. People we hear a lot about concussions these days, but it makes your skin crawl when you talk about a kid who's just jumping his bike over some terrain, and the front fork and wheel of the bike fall off. And he obviously crashed. It was a manufacturer's defect, apparently, and we have no idea how long he was out. He was referred to me by the local rehab hospital, and so he was unconscious for some time. Somehow, from 3 or 4 blocks away from home, he managed to drag himself home. And so they had done occupational therapy, physical therapy, had done vestibular therapy, and they sent him to me because they were concerned about his eye problems, his vision problems. And so I tested him as I test everybody, and found some suppression, and that's what we zeroed in on trying to treat. He still is a bright kid, an athlete, and all the things you want in a high school student. But when he was in to see me, it was almost like he some of the stages of grief, kind of. He was just angry, and you could do a little bit with him, and then he would be unable to do things.
What were some of the symptoms that he came in with?
He was dizzy, and he couldn't sustain close work. He had all the classic kind of reading symptoms that we talk about with dyslexia, in quotes, losing his place, can't remember what he was reading, skipping words, all of that stuff. And again, you take a bright kid, and then all of a sudden he can't read and can't do things like that, and he's not a happy guy. And we had to start very slowly with him, because we could do a little bit of simple stuff, eye movements or something like that, and he was done. He could not go on, and we very slowly managed to get him to where we could do more active anti-suppression therapy. We used rapid alternation on him. One of the things that was interesting on him was we could start him out just having, and this is a high school kid, right? This is a guy that wants to go to medical school, and we started him out doing a coloring on a desk, while we were rapidly alternating between his eyes. And that actually it was sort of like it primed his eyes to be able to do the other therapy. And then it was pretty standard therapy beyond that, working on his suppression, his eye movements, convergence, all of those things. But we kept after the suppression to try to get it gone. As we got rid of the suppression, then very slowly his stereopsis came around, and there was another interesting thing. I said that in the article that he described his depth perception, or we would probably say stereopsis, but he described his depth perception as coming on in waves in different parts of his visual field. And so we kept working on him as we were allowed. He had a second accident when a lady threw her car door in front of him. He gets everywhere on a bicycle, and so this is also an athlete. And
Now, Dr. Hussey, you said that you used you did some alternating between the eyes.
mhm.
How did you do that?
Well, we use liquid crystal lenses. We were alternating on him. Basically, for most of the therapy we worked at 5 hertz, 5 hertz, and even alternation between the eyes. But there were different frequencies in the article. I have a list of different frequencies that, on a particular day, made his eyes stay alive, made him stay active, made the suppression less on a particular day. And so, but basically he would do colorings, he would do, we call it colors. It's chiroscopic tracings, but we have whoever it is, not just kids, adults, we have them color in the picture instead of just trace on the lines. And the idea is very simple. If we're going to treat a suppression, there has to be motion and bilateral sight. And so we want this scrubbing kind of action across the central vision, if you will. And so we have them do that. And so we had them do a lot of those with alternating between the eyes with liquid crystals. There are lots of different activities that we can do that with, and I think that was a prime driver in changing the suppression.
Very cool. And at this point, is Seth has returned to school and he's able to find success?
Yeah, last time I talked to him, which has been a while, but last time I talked to him, he could read for hours. You know, we started with dyslexia, if you will, and now he can read for hours. He's in ROTC out there, and out at a local college out there. Doesn't mean much on the video, does it? But at a local college, and he's still looking at going to medical school. So bright kid.
Very cool. And if there's kind of a take-home message for the readers about this in treating a patient like this, what do you think you might tell them?
I guess there'd be two things. Number one, and I think most people that work with trauma would grab this one immediately, and that is you have to work within the bounds you're given by the patient. It's not like you can sit somebody down with trauma and do hours of therapy working their eyes hard and that they're going to tolerate it. But the second thing is that is a consistent drumbeat with me, and that is when you mess with central vision. So when you do things like have a suppression in the central vision, that goofs up a lot of things. That's an afferent defect to the brain, and the brain doesn't have the information it needs to aim properly, to keep both eyes in the same place at the same time, and it goofs up how people see. And so that's one of the prime things that we want to treat.
Wonderful. I certainly look forward to hearing more about Seth in the future, and hopefully he can get to be a doctor and can come by and thank you again. Maybe give you a physical.
Well, it depends on exactly the specialty, whether I'm going to allow him to do that. But I will say hi to him. So.
Okay, that's a good deal. Well, thank you so much for joining us, and look forward to seeing you again soon.